So my patient just got his blood work done recently, and not by me, but by another physician. And so we're going to review those and talk about that. The first thing we're going to talk about is you did an iron panel. And whatever doctor did it, I'm really impressed because they added a ferritin level. So ferritin is very important. That's stored iron. It's often the first iron marker to show up as a deficiency leading to an anemia. And so it's really important. It's also really important because they did studies that show that kids with ADHD are oftentimes low in ferritin, low in stored iron, and when they supplement them, they do so much better before they even need a medication. So ferritin's a really important one. I'm glad that your doctor decided to do it. We're going to look at a few things. The next on their list is testosterone. And are you okay me sharing what your testosterone level is? Okay, so it was a 400. With labs like this, what you're going to find is that the ranges are really wide. Optimal is really narrow, somewhere in the middle, right or left, depending on the lab. And symptoms happen between optimal and falling off the edges. But a lot of physicians won't even look at a lab unless it's fallen off the edge and it's stayed there, or it's gotten worse. And so what we do as functional medicine doctors is we look and see what's out of functional range, out of optimal range, and if you're having symptoms that relates to it. Because we're trying to optimize the system. So 1, you don't get sick, and 2, you feel great.
Perfect.
Okay? So a 400 testosterone is fine. It's between their big range of 250 to 1100. But functional medicine ranges actually start around 800. So there's definitely room for improvement, and I would not suggest you take testosterone or do anything to increase it that way, but building muscle will help you increase testosterone. But if you don't have symptoms, I'm not worried about it, but it's just that we're going to be looking, and if you have symptoms that come up, then we might say, okay, let's eat more protein to build more muscle, better recovery, so that testosterone goes up. Sound good? Good. Thyroid, they did look at TSH. This is very typical for a lot of labs. They'll do TSH, and if TSH is not out of range, they won't do any others. And if they do, they might do just T4. But yours was in range. We like it between 1 and 2, and you were 1.39, just fine. If that were high, I would want to look for reasons why, and I would want to do a full thyroid panel, including antibodies. Even if you had symptoms of low thyroid and that was normal, I would still want further testing. Your vitamin D level's at 34. We like that around 70 also. And because it's so low, I asked you how long you've been taking your vitamin D for. But it was only a month after, since this. And so it's going to take some time to come up. So I would say next time we do it, make sure you've been consistently on your vitamin D for a period of time. Vitamin D is important because it helps with leaky gut, it helps with depression, it helps with bone pain. It's almost like a hormone, it's so important. And it's great for the immune system. Okay? Very good. The blood sugar marker, hemoglobin A1C, I didn't mention this, but you're at 5.5. That is a fine place to be. I like it around 5.4 and lower, but 5.5 is not a problem. They did do an inflammatory marker called ApoB. That's a great marker to look at for cardiovascular, and that was well within range at 88.
Great.
So thank you for sharing your labs with me. It's really helpful for me to kind of get a gauge on what doctors are looking at and how your overall health is. So thank you for that.